I am an immigrant. My family moved to Utah, to Salt Lake, when I was 7 years old from Mexico, and I got really sick around that same time. We didn't have very much money, we didn't have insurance, and my mom was really worried about me, so she took me down to the 4th Street Clinic because she heard that's where people that didn't have insurance or money could get help.
These are some of the memories that led Moroni Lopez to go to medical school.
And from that moment on, I've kind of always thought that I wanted to do something like that and to give back to the community that I came from.
Part of his education includes helping those who may not always receive proper care. The Tribal Rural Underserved Medical Education, or TRU, is a fairly new program at the University of Utah. Medical students observe firsthand the roles providers and community health organizations play in assuring health and wellness for everyone. Dr. Aaron Baya from the Navajo Nation helps mentor the students. He says it gives them invaluable experience in indigenous medicine and rural experiences.
You can teach other medical students who are not from the area to really highlight the fact that there are challenges in medicine. The rural medicine is a very different aspect of life. Sometimes you're the only clinician there, and a lot of your patients and resources really depend on you to be that rural doctor, to really know everything.
Once he's done with his residency, he says he hopes to bring his medical skills back home.
I was one of those kids that said I always wanted to go to medical school when I was younger. I had a great inspiration from my grandfather, who is a Navajo traditional healer, be that Navajo provider that we didn't have much when I was growing up.
TRU is going on its 2nd year, and Dr. David Sandweiss is the program director.
Utah is ranked pretty low in primary care provider to population ratio, and we know that that's going to be getting worse over the next few years as primary care providers in underserved communities, in particular rural communities, age out, and we need to fill those slots with docs.
Dr. Yvette Lopez is with the Public Health Department of Family and Preventive Medicine with the University of Utah.
I think that the proportion of minority physicians to what is needed is way below.
She's working with the community health workers to hopefully bridge the gap of underserved communities.
When the services are delivered in a one-size-fits-all way, it doesn't work, because one size doesn't fit all, does it? We need to make sure that each population is taken care of, not just some.
The future Dr. Moroni Lopez will be doing his part to help build that bridge over health inequities.
For me to be able to go in and work with my community, have somebody that looks like them, that talks like them. I'm fluent in Spanish, to have the level of training that the school gives to me, and then to be able to bring that to these communities it's like a full circle for me.
And he's not the only one in his family to do so.
My mom actually is about to graduate from nursing school. Yeah, she's got 5 kids. After my youngest brother was in high school, she started going back to school at Salt Lake Community College. She's the one person that's constantly just pushing to go into healthcare, and she beat me to it, but I'm very happy she did.
For Utah Insight, I'm Rayanne Christensen.